Vacuum massage is not just a trend in the field of beauty, but a proven method for improving health, body shape, and well-being. This course is designed for those who want to master the effective technique and understand how to use it correctly and safely, in their professional activities or for themselves. In this course, you will gain systematic knowledge about vacuum massage, how and why it works, how to perform it correctly, and how to accompany a client for a long-lasting result. You will find 7 consecutive modules, from the basics and techniques of massage to procedure protocols, working with different types of clients, and building a professional service. Join the course and discover an art that combines science, touch, and real results. Your journey to new knowledge begins here. Welcome to the first module of the training course on the basics of vacuum massage. This method, which combines therapeutic and cosmetic effects, deservedly occupies one of the leading places in modern aesthetic body correction practices. So what is vacuum massage? It is a special technique based on the use of negative pressure for deep stimulation of the skin, subcutaneous fat tissue, and even muscle layers. It is actively used to combat cellulite, correct local fat deposits, eliminate orange peel, and generally improve tissue condition. And at the same time, without harming the skin. On the contrary, after a course of procedures, the skin becomes more elastic, tightened, and sagging disappears. A course of vacuum massage usually consists of 7 to 10 procedures, with an interval of 1 to 3 days. This is the optimal rhythm for stimulating metabolic processes in tissues, activating blood circulation and lymphatic drainage. The effects that can be achieved with vacuum massage are impressive. Firstly, it reduces body volume and the severity of cellulite, even in advanced stages. Secondly, it significantly improves skin quality, increasing its elasticity, firmness, and even tone. In addition, vacuum massage activates the removal of toxins and stagnant fluid and stimulates the lymphatic system. Massage also has a positive effect on muscle tone. It reduces spasms and fatigue and improves well-being. This is especially important to consider when evaluating the indications for the procedure. Vacuum massage is recommended for cellulite at any stage in cases of local edema, stagnant phenomena, reduced skin tone, muscle fatigue, and also as an effective prevention of blood and lymph circulation disorders. It is a universal tool for maintaining beauty, health, and the body's internal resources. However, it is important to remember that, like any effect on the body, vacuum massage has its contraindications. The procedure is not performed in cases of cancer, infections, inflammatory processes, thrombophlebitis, severe varicose veins, cardiovascular diseases, in particular heart attack, angina pectoris, heart defects. Other contraindications include convulsive syndrome, fungal or pustular skin lesions, the second and third trimesters of pregnancy, and alcohol intoxication. These restrictions should be memorized. This is your area of responsibility as a specialist. And even in the absence of direct contraindications, always follow safety rules. In particular, the movement of the nozzle should be directed strictly along the course of venous and lymphatic outflow. This is a key principle that prevents damage to vascular valves and the development of spider veins or varicose veins. This nuance is critically important, especially when working with the legs. It is equally important to work with the anatomical features of the body in mind. For example, the inner thigh is an area where the femoral artery passes. Maximum caution is required here, as well as in the lymph node area. Pressure should be minimal. Preparation is mandatory before the procedure. Warm up the tissues manually. Perform a light massage, during which you can not only increase the effectiveness of the upcoming procedure, but also diagnose the presence of lumps, muscle spasms, or stagnant areas. This is another element of your professionalism. When the procedure is complete, remove the attachment carefully. Do not pull or tear it off the body surface. This causes discomfort and may leave bruises. Instead, simply press the skin near the edge of the attachment or gently rotate it parallel to the skin. And finally, pay attention to areas that are not subject to vacuum exposure at all. These are areas with active inflammation, postoperative scars, the heart, eyes, and ears, also the abdomen of pregnant women. All these areas are completely excluded from treatment. Compliance with these rules is the basis of safe and professional practice. Remember, client trust begins with your competence. Let's begin the second module, vacuum massage methodology. Here we will take a detailed look at how to properly prepare for the procedure, the principles it is performed, and what constitutes effective and safe work with the client's body. The vacuum massage technique is not just a technique, but a clearly structured system. It includes a set of actions aimed at activating blood and lymph circulation, stimulate metabolism, improve skin tone, and eliminate stagnation in tissues. A professional must take into account not only the indications and contraindications, but also the technical parameters of the device, skin type, and individual characteristics of the client. Before starting any procedure, a mandatory skin examination is performed. This allows you to identify damage, rashes, varicose veins, moles, or bruises. Remember, if there are any lesions in the area, massage is prohibited. This is not only a matter of aesthetics, but also of client safety. Consultation is the next mandatory step. The specialist finds out the client's medical history, the presence of chronic diseases, the state of cardiovascular system, allergies, tendency to edema, or problems with the lymphatic system. The skin is cleansed with lotion or antiseptic tonic, removing any traces of cream and cosmetics. After that, a special gel or massage oil is applied, a product that ensures the attachment glides smoothly, reduces friction, and minimizes the risk of irritation. The type of attachment is selected depending on the area you're working with and the desired effect. For large areas of the body, use wide attachments. For localized treatment, use smaller ones. Flatter roller attachments are also used depending on the task. The basic movements used during vacuum massage are linear, from the periphery to the center, spiral, activate microcirculation, zigzag, help relax muscles. The procedure always starts with minimal pressure, approximately 10 to 20 centimeters of mercury. During the procedure, the pressure is gradually increased to a level that is comfortable for the client, but no more than 30 centimeters of mercury for dynamic massage. The duration of treatment for one area is 3 to 7 minutes, depending on the thickness of the fat layer and individual sensitivity. The total duration of the session is 15 to 60 minutes. And remember, the direction of movement of the nozzle must clearly coincide with the lymphatic and venous outflow. This is especially important when working with the limbs or during lymphatic drainage. This rule is the basis for safety and effectiveness. The optimal frequency of vacuum massage is 1 to 2 times a week. The course consists of 10 to 15 procedures. After that, it is recommended to conduct maintenance sessions, 1 to 2 times a month for. Vacuum massage combines perfectly with other aesthetic procedures. A comprehensive approach allows you to achieve deeper and more stable results in body shaping, cellulite reduction, and skin improvement. A competent combination of procedures allows you to enhance lymphatic drainage, activate fat breakdown, increase skin elasticity, reduce the appearance of cellulite. However, it is important to take into account the individual characteristics of the client, age, skin condition, medical history, and response to stress. The combination of vacuum massage and radiofrequency lifting provides an excellent lifting effect. RF stimulates collagen synthesis, while vacuum prepares the tissues by improving blood circulation. It is recommended to perform massage first, followed by RF. The interval between procedures is on the same day or after 1 to 2 days. Cavitation is the targeted destruction of fat using ultrasound. Vacuum massage performed afterwards helps to remove the breakdown products through the lymphatic system more quickly. This combination enhances the result and accelerates weight loss. After reducing tissue volume, it is important to strengthen the muscular framework. Myostimulation performs this function and improves the relief. First, vacuum for drainage, then myostimulation. The procedures can be performed on the same day or with a 24-hour break. Wraps are another way to enhance the effect. Heat or cold wraps are performed immediately after massage. When the skin is activated, this helps to remove toxins and saturate the skin with beneficial substances. Assess the condition of the skin before any combination. Avoid excessive stress on the same area in one day. Moisturizing and recovery are mandatory between procedures. Explain to clients the importance of breaks and rest. This increases the effectiveness and trust in you as a specialist. Let's move on to the third module of the course: types of vacuum exposure and modes. Here we will take a detailed look at the existing methods and modes of working with vacuum, their characteristics, and how to choose the right intensity for an effective and safe procedure. In the practice of vacuum massage, two basic methods of exposure are used: kinetic or labile, when the attachment moves across the skin, and static, when the cup or attachment is fixed immovably on a specific area. Each of them has its own advantages and indications for use. With the kinetic technique, the attachment is constantly moved across the skin. The pressure is usually low, from 10 to 30 centimeters of mercury. The movements can be longitudinal, transverse, circular, zigzag. The goal is to achieve slight hyperemia, warm the tissues, and start the drainage processes. This method stimulates lymphatic drainage, accelerates microcirculation, relaxes soft tissues, and increases the temperature in the area of influence by 3 to 5 degrees. This triggers active cellular respiration, reduces stagnation, and promotes local fat burning. The static technique involves fixing the cups on a specific area of the body. In this case, the pressure can be higher, up to 60 centimeters of mercury, and the exposure time from 1 to 10 minutes, depending on the task and tissue response. Blood, lymph, and intercellular fluid accumulate in the treatment area. This promotes deep tissue cleansing and has a pronounced restorative effect in chronic stagnant or inflammatory conditions. It is especially effective on muscles and connective tissue. The vacuum mode can be continuous or pulsed. Continuous mode involves continuous tissue suction, while pulsed mode involves alternating pressure and pauses, which are regulated by the frequency of pulsations. Continuous vacuum provides intensive work and deeper skin suction. It is used in classic vacuum or lymphatic drainage massage, as well as in static mode. This is a deep action mode, but it requires caution. Pulsed mode is gentler. The skin is alternately drawn into the attachment and released. This mode is suitable for sensitive areas, for a client's first experience with the procedure, as well as when working with thin or reactive skin. Correctly selected pressure intensity is the basis for safety and effectiveness. Too weak pressure will not produce results. Too strong pressure will cause side effects. Therefore, it is important to clearly understand the basic principles of selection. Always start with minimal pressure, especially during the first sessions. Gradually increase the intensity, focusing on the client's comfort. Be sure to consider the method, mobile or static. For the first procedures and sensitive skin, the recommended pressure is 10 to 20 centimeters of mercury. The optimal level for most areas is up to 30 centimeters of mercury. Important: when moving the attachment, do not exceed this value to avoid injury. Never exceed 30 centimeters of mercury when using the kinetic method. This can cause pain, microtrauma, bruising, and even microcirculation disorders. Your goal is to achieve results without harming your body. In static mode, a higher intensity is permissible, up to 55 to 65 centimeters of mercury. However, this requires strict control of the exposure time. This method is suitable for deep local work, in particular for fibrous cellulite or chronic muscle congestion. The type of attachment must correspond to the area of influence and the task. For large areas, such as the thighs, buttocks, back, or abdomen, large attachments are used. Medium attachments are suitable for the arms or abdomen. Small attachments are used to treat local areas with sensitive skin. it is also important to consider the presence of edema or pronounced cellulite. In this module, we will talk about how to consolidate the results of vacuum massage through proper home care. This is a mandatory step in the program if you want not just a short-term effect, but a stable improvement in the condition of your skin and figure. Proper home care after the procedure is a continuation of your professional work. It allows you to enhance the lymphatic drainage effect, activate metabolism, maintain skin tone, and reduce the risk of cellulite recurrence. In other words, home care helps to maintain the result for a long time. First of all, the drinking regime. For 1 to 2 days after the massage, you need to drink more clean water, at least 2 to 2.5 liters per day. This will help activate the removal of toxins and fat cell breakdown products, which is triggered by the procedure. Light physical activity is recommended. Walking, yoga, swimming. It improves blood circulation, stimulates lymphatic drainage, and maintains muscle tone. Avoid complete inactivity after the procedure. Movement helps the body work better. Nutrition also plays an important role. Avoid fatty, salty, and overly sweet foods. Give preference to proteins, vegetables, fruits, and whole grains. This helps cleanse the body and improve skin tone. Add anti-cellulite and moisturizing creams to your skincare routine. Apply them 1 to 2 times a day with light massage movements. This will maintain skin elasticity and enhance the effect of the procedure. Alcohol and smoking significantly reduce the effectiveness of the course. They slow down tissue regeneration and can cause fluid retention. Even temporarily giving up these factors will improve the result. Do not visit saunas, baths, or take hot baths for 24 hours after the massage. This will avoid overloading the vascular system and preserve the results of the treatment. Light self-massage with an anti-cellulite brush or oil can be used between sessions. This will help maintain blood circulation, relieve tension, and preserve the lymphatic drainage effect. After massage, fluid removal through the lymphatic system is enhanced. In case of swelling or heaviness in the limbs, natural diuretics may be recommended. However, they should be used with caution, only when necessary. Natural stimulation of fluid excretion is recommended in cases where there is swelling, a feeling of heaviness in the limbs, or a tendency to retain fluid in the body. Such symptoms indicate a slowdown in lymphatic flow and require a gentle, physiological approach to drainage. The priority is natural remedies. This includes foods with a mild diuretic effect: cucumbers, watermelons, celery, parsley. Also teas made from lingonberry leaves, nettle or horsetail. And don't forget, increased water intake in itself stimulates the excretion of fluid in a natural way. It is strictly forbidden to take pharmacy diuretics without a doctor's advice. They can cause dehydration, electrolyte imbalance, and serious side effects. Remember, the main goal of home care is not aggressive intervention, but gentle, reasonable support of the body. Following simple recommendations will help you not only maintain the result, but also gradually improve it. Let's move on to the 5th module, dedicated to practical vacuum massage protocols. Let's start with the basic procedure: vacuum lymphatic drainage, which is the basis for body shaping, detoxification, and metabolism normalization. Vacuum lymphatic drainage is a preparatory stage before any intensive body correction. It gently starts drainage processes, cleanses tissues, and prepares them for active work. This is a special procedure that stimulates the work of lymphatic capillaries and collectors. It is indicated in case of edema, congestion, slow metabolism, as well as in case of reduced immune defense. Its main goal is to activate the outflow of stagnant lymph and cleanse tissues at the cellular level. Lymphatic drainage is the first step before anticellulite or modeling procedures. After drainage, the tissues are cleansed of toxins and better perceive active ingredients and physical activity. It helps to avoid swelling, uneven results, and ensures uniform fluid removal from the body. The vacuum effect in this case is soft, low pressure, with a pressure of up to 20 to 30 centimeters of mercury. The movement of the nozzle is always directed along the course of lymphatic drainage, from the periphery to the nearest lymph nodes. The mode is mostly pulsed, sometimes continuous. The procedure includes several stages: cleansing the skin and applying massage oil, manual heating of tissues, 3 to 5 minutes, connecting the device, setting the pressure and mode, massage in the direction of the lymph nodes according to the scheme. To avoid unnecessary movements of the client, the work is carried out in a certain sequence. In the supine position, the abdomen, décolletage, front of the thighs, patellar area, front surface of the legs are treated. Then, in the supine position, the back, buttocks, back and inner thighs, calves. All movements are performed along the course of the lymphatic flow, without disturbing the natural pattern. At the beginning of the course, after the procedure, there may be a temporary increase in the visible manifestations of cellulite. The skin may look bumpy, with clearly defined micronodules. This is normal, the fluid is gone, but the dense fatty structures remain. In subsequent sessions, the nodes gradually dissolve. One procedure lasts 15 to 20 minutes. The course is 10 to 15 procedures, with a frequency of 1 to 2 times a week. To maintain the result, it is recommended to conduct 1 or 2 procedures every month. This is the basis for a sustainable and safe result in the body modeling program. This video demonstrates the technique of vacuum lymphatic drainage, a gentle, physiologically based effect on the body. All key drainage areas are worked on: abdomen, décolletage, shoulders, hips, knees, legs, back, and buttocks. The pressure is minimal, the movements are slow, directed exclusively along the lymphatic flow. This technique is used both independently and as a preparation for intensive procedures. reduction of volumes and improvement of skin tone. We continue to study vacuum massage protocols. In this part of the module, we will look at an intensive technique for affecting adipose and connective tissue, the so-called vacuum anti-cellulite massage. This type of massage is an active method of body sculpting. It works locally, affecting subcutaneous fat and fibrous structures that form cellulite. The goal is not just to stimulate blood circulation, but to work deeply on problem areas. Under the influence of vacuum, blood flow in the deep layers of tissues is activated. This allows you to open reserve capillaries that do not normally work. The massage also reaches the muscle layer, relaxing it. The key effect is defibrosing. Fibrous adhesions and nodes that are the basis of cellulite are destroyed. And most importantly, it stimulates lipolysis, that is, the breakdown of fat. For fat to start breaking down, you need to ensure good blood circulation in the tissues. If there is stagnation, the process stops. The vacuum activates microcirculation, saturates cells with oxygen, and this is what triggers lipolysis. That is, we create conditions in which the body burns fat naturally. The procedure begins with skin preparation. First, the surface is cleaned. Then, applying a small amount of massage oil. After that, manual heating is required for 3 to 5 minutes. Next, a suitable nozzle is selected by diameter, depending on the area, and the device is adjusted. The mode, constant or pulsed, and the retraction force are selected, focusing on the client's sensitivity. Movements are performed randomly, but taking into account physiology. Possible directions are straight, circular, zigzag. Important intensity, until the skin slightly reddened. This is a sign that the vessels are activated but not overloaded. It is necessary to control the uniformity of pressure, avoid areas with varicose veins, inflammation, and postoperative scars. The duration of one session is 30 to 60 minutes, depending on the number of zones. The procedures are performed 1 to 2 times a week. The course consists of 10 to 15 procedures. Afterwards, maintenance sessions are recommended 1 to 2 times a month to stabilize the result. To minimize the client's turning over and make the procedure comfortable, the treatment of zones has a logical sequence. We start in the supine position. We treat the abdomen and the front of the thighs. Then, the supine position, back, buttocks, back of the thighs, calf muscles, arms. This order allows for continuous lymphatic drainage flow and does not disturb the natural flow of fluid in the body. Vacuum massage is not just a procedure, but a precise tool for influencing deep tissue structures. The result depends on the knowledge of physiology, technique, modes, and the correct sequence of actions. This video demonstrates the technique of performing a vacuum body massage. The massage covers the main areas: abdomen, thighs, buttocks, back, arms, décolletage, and calves. Pay attention to the direction of movement of the nozzle, gradual development of the zones, the choice of rollers, and the logic of the drainage flow. This technique is aimed at improving skin tone, reducing cellulite, and activating metabolism. and avoid linear stresses. Movements with a large roller from the inner thigh outward. Vacuum massage is performed in the décolleté area. The movements are as delicate as possible, strictly along the lines of the diagram. This is a sensitive area where the vacuum stimulates drainage, improves skin color, and helps to tighten it. The movements are slow and controlled. Excessive pressure and tension are avoided. In the final section of the fifth module, we will consider a separate format of work, zonal vacuum massage. This approach allows you to focus only on specific areas of the body that need correction. Vacuum massage does not have to be performed all over the body. In many cases, it is advisable to choose only a specific area. For example, the abdomen, thighs, or arms. This is especially true when the client has localized problems or time constraints. The areas of the upper body include abdomen, back, arms. Indications for their treatment are improvement of microcirculation, reduction of fat deposits in the waist area and above the shoulder blades, relieving muscle tension in the back, modeling the relief of the hands. This option is often used in weight loss programs or during sedentary work. Areas of the lower body, front, back, and inner thighs, buttocks, calf muscle. This segment is the most commonly used in anti-cellulite programs. Indications: reducing the appearance of cellulite, improving skin tone, prevention of edema, improvement of lymphatic drainage, shaping the contours of the legs and buttocks. The zonal approach has several important advantages. Shorter session duration, only 20 to 30 minutes. Targeted work with a specific problem area. Convenience for the client, especially with a tight schedule. The possibility of more frequent use compared to a full-body session. Zonal vacuum massage is a flexible tool that allows you to adapt the procedure to the client's needs, ensuring effectiveness even with limited time. The video presents the technique of vacuum massage of the upper body. The abdomen, décolleté, back, and arms are worked on using the middle roller. The technique is performed taking into account the sensitivity of the zones and the logic of lymphatic drainage. Pay attention to the uniformity of pressure, the choice of attachments, and the sequence of treatment. The middle roller glides in a classic pattern. The area along the spine and lower back is treated, avoiding direct pressure on bone structures. The goal is to relieve muscle tension, improve venous and lymphatic outflow.
Нравится тут так? Прикольно?
The next area is the arms. The area is treated from the elbow to the shoulder, in the direction of lymph flow, to the axillary nodes. The massage is performed with the middle roller, from the inside of the arm to the outside. This helps to reduce volume, improve microcirculation, and improve skin tone. Completion of work with the hands. The technique is based on the principle of step-by-step symmetrical tissue treatment, taking into account the natural anatomical relief. This ensures an aesthetic result without trauma. Upper body massage is not only about the external effect, but also about a deep physiological effect. Stress relief, normalization of blood and lymph flow, and improvement of well-being. In this video, you will see a detailed demonstration of the lower body vacuum massage technique. Particular attention is paid to the front and back of the thighs, buttocks, areas above the knee, and calf muscles. Movements are performed in accordance with drainage patterns, observing the direction of lymphatic drainage. This is one of the key protocols in the fight against cellulite and edema. The In the sixth module of our course, we will look at the theoretical basis, what cellulite is, why it occurs, what degrees it has, and how it manifests itself. This will allow you to better understand why vacuum massage is so effective in fighting it. Cellulite is a structural change in subcutaneous fatty tissue that appears as a wavy or bumpy skin surface. It most often appears in the thighs, buttocks, abdomen, and arms. In medicine, it is called gynoid lipodystrophy. This is not a disease in the classical sense, but a cosmetic and physiological condition that affects body aesthetics and well-being. Cellulite occurs due to impaired microcirculation, lymphatic drainage, and loss of connective tissue elasticity. When the fluid stagnates, swelling begins, and the pressure on collagen fibers increases. Fat cells grow larger and tissues lose their flexibility, which is how bumps and depressions appear on the skin. There are many causes of cellulite, and they are often combined. First, hormonal changes. Estrogens play a particularly important role, affecting water-salt balance and fat metabolism. Secondly, a sedentary lifestyle. Without muscle activity, blood and lymph circulate slowly, which contributes to stagnation. The third factor is nutrition. Excess sugar, salt, and fat contribute to the accumulation of toxins and an increase in fat cells. Next is stress. It causes muscle spasm, lowers metabolic rate, and triggers hormonal disruptions. Heredity should also be taken into account. A genetic predisposition to poor microcirculation is of great importance. And finally, bad habits. Smoking, alcohol, excessive caffeine. All these factors worsen the condition of blood vessels and tissues. Cellulite has 4 stages of development. The first one is hidden. The skin looks smooth, but there are already disturbances at the level of microcirculation. The second is moderate. The orange peel is visible only when squeezed. Mild swelling is possible. The third is obvious. The bump is visible without compression. The skin loses its elasticity. Discomfort appears. The fourth is severe. The nodules are dense, painful, and the skin may be cold. Blood flow is significantly impaired. There are several types of cellulite. Water, edematous, characteristic of the initial stages, associated with fluid retention. Fatty, soft cellulite is the most common. It is caused by an increase in the volume of fat cells. Fibrous, hard, tissue compaction, formation of nodes and scars, difficult to correct. Mixed type combines several forms at the same time, and it is the most common. Cellulite is a multifactorial process that includes circulatory disorders, lymph stagnation, hormonal disorders, and lifestyle. Understanding it is the basis for effective correction. And that is why vacuum massage, as a physiologically based procedure, gives a lasting and visible result. In this module, we will look not at the technique, but at the human factor, the client's psychology, because a true professional is not only hands, but also empathy, flexibility, and the ability to establish contact. People come to massage for different purposes: physical, emotional, and even psychological. Therefore, it is important not only to master the technique, but also to be able to adapt the approach, taking into account the body, character, and condition of each client. This increases the level of trust and builds a stable customer base. Overweight clients often have increased sensitivity to pressure, a tendency to swelling, and poor microcirculation. It is important to be especially delicate here, explaining that the results will be gradual and require a systematic approach. Thin clients have thin skin with increased sensitivity to vacuum. They can feel discomfort even with minimal pressure. It is important to avoid pain and focus on gentle techniques that improve tone and microcirculation. Athletes have dense muscle tissue and a high pain threshold. You can work deeper with them, with an emphasis on relieving muscle tension and speeding up recovery, especially after training or competition. It is important to take into account not only the body, but also the psycho-emotional state of the client. An anxious type requires more time for adaptation, a calm atmosphere, and soft communication. It is worth explaining every step to relieve tension. Closed client does not like too active communication, avoids eye contact. Respect their boundaries, don't push for emotionality. A verbose or emotional client is easy to contact, needs support and verbal feedback. But do not forget about professional boundaries. Calmness and confidence are always important. The pressure and strength of the vacuum effect should be adjusted individually. The duration of the session depends not only on the area, but also on the client's psychological readiness. Some people need light lymphatic drainage, while others need a deep anti-cellulite technique. Be sure to talk through your expectations. What results are possible? In what time frame? And under what conditions? Ethics is not an option, but the foundation of the profession. Every client deserves respect, regardless of body shape, age, or beliefs. A massage therapist should be neutral, tactful, and create a space without judgment. Mandatory principles are confidentiality, respect for personal boundaries, and consent to any actions.